Veneers is one that we get is pretty common, right? That's what everyone wants to think of when they think of like the bright smile, right? Sometimes for veneers and crowns, there's not a whole lot of difference. There is a small difference. So when we do a crown, we're cutting, a little bit, taking a little bit more of the tooth away, whereas veneer, it's a lot more minimal of a prep design, which is good. If we can, we like to take less away, right? When it comes to designing all of this stuff. So veneer is going to be basically just a porcelain crown or ceramic that goes on the front of the tooth, and it's bonded onto the front. So for someone who had, it's one that we see a lot, right? And it's very common is, you see what we call peg laterals, where your lateral incisors are just a little bit smaller than the rest of your teeth. So proportionally they look a little off. Maybe you have a little space, maybe they're just a little small. So what we can do is, a lot of times with those, we don't even have to prep at all. What we can do is we can just take an impression, and we can do what we call a no prep veneer, which is fantastic. It's great. And something it would shock you for you to see just how something so small like that can change someone's smile, right? So you may have just a little bitty space on either side of that tooth, and just you have that little small looking tooth on right there in the front. But if you get a tooth that comes in and is proportionate in size, it changes the whole way your smile looks. It really does. And so I think that's a great use for veneers. Obviously, people who have great teeth, they don't have any cavities, like we talked about, right? Like sometimes when you talk about cosmetic mixing with general dentistry, sometimes they have wants and needs. They may need, a more aggressive, or they may have cavities. They may have, okay, we may do crowns there. But when we're talking about veneers, they're great for the average person who has no cavities, teeth look great. They just, I don't like the shade of mine. I've tried whitening, I've tried this, I've been in ortho, don't like the shape of my teeth, I don't like the size of my teeth, I don't like the shade of my teeth. What can we do about it? Enter veneers, right? Something that's minimal prep, so we don't have to take too much tooth away, right? But still give them and deliver to them a bright new smile with some porcelain ceramics that look fantastic.